good. Looks like it will cooperate this time. Okay, we are the correct way this time. Are you sharing, Mayor?
Not yet, I don't see it yet. I'll just refresh. There I do now.
We're just going to share to a few sites before we get started.
I'll share.
Sorry for the false start, everybody. Yeah, if you can.
That's where you want me to show it, Kim.
Hey, Gallison? Pepper Gallison?
Alright, I'll let you guys do that. Tracy Crutcher says, good afternoon, ladies.
Hey, Tracy. Put Gallus number 2, I'm doing that one.
Okay. Got some routine watchers on here.
Our faithful watchers.
I know. Howdy, Jamie. Joey's on here. Hey, she works in one of our ERs here. Shout out to them and all they're doing right now. We know they're working harder than ever.
Yes, thank you, all of our healthcare workers that are. Can't believe you're even having a chance to watch this. You must wish to sleep every hour that you're not working right now. Thank you for what you guys are doing. Somebody sent an email yesterday about dog grooming. I'll go ahead and announce that or mention that while I think I did see that and I was going to research it, but I think that you should be considered essential under the animal care one. Did you have a different opinion on that?
I mean, I think that's what it is. It's a matter of opinion on that. And
it's about face-to-face service. So anything that's not essential that you're having to get close to another person is anything non-essential where you have to get close to another person is what they're trying to stop happening. So if you can avoid any contact with people, I think you should be safe. Of course, I should probably say consult with your attorney or government. I did, if you want to Google Governor Lee Order 21, then you'll be able to actually read all that's in that order where the non-essential businesses are listed. There's also on Order 22 a list of the essential businesses, and you can look there and visit the Homeland Security's list of essential businesses, and that will help you see what they consider essential.
And I will say on that, I know that a lot of our businesses in the community are trying to keep up with what their competitors are doing and making sure they're doing the right thing in terms of what other industry partners are doing. And I know that I spoke with someone who's actually watching, Jamie's watching, and he told me yesterday that his groomer had made modifications, and I guess they weren't booking animals until after a certain date. So, I mean, I think that if you want to look at some other groomers in the area and see what they're doing, that might be a good idea. But I also think that the face-to-face contact and limiting that, if there's a way you can modify your business and a dog be dropped off, or and you don't have to see another human, then that could be an option. But certainly, like the mayor said, consult your counsel.
Yeah. Okay, we'll officially start now, I do believe. Good afternoon, everyone. We do appreciate you joining us again. I'm Paige Brown. I'm the mayor of the city of Gallatin. With me is Kim Baker, CEO of the Gallatin Chamber. And our special guest is Ann Lynn, who is Kim's daughter. And Ann Lynn, I want you to know somebody's already said how much they like your hair bow. She was a little resistant this morning, or this afternoon. I want to say thank you again to everyone who is working hard to keep other spirits high and do good things in our community and support your neighbors. It is getting tiresome, and I'm hearing from people who are acknowledging that. And some people are starting to even say our new normal. And we hope if this is the new normal, it is only short term. But it is such a difficult time. And I'm going to suggest today, because I think people say they're tired of hearing the same thing from us. I'm tired of saying it. But I'm going to suggest today that, we all be the person to set the example and to share information and to do that thing that our parents told us to do a long time ago, to lead by example. And we can do that in a lot of ways. And I happened to be somewhere the other day, and I was around a mother and her two sons, and I had my wipes, and I was not touching anything and stuff. And one boy, I guess the younger boy, had asked the older boy, why is she doing that? And I heard the older boy say, some people are taking this really seriously. And so I appreciate the fact that the older boy was becoming aware of that. I don't think the mother was necessarily aware, but I didn't say anything to him, but I felt like, oh, that could have been a good opportunity. And so look for those opportunities and help set good examples too by encouraging and championing those who we see are doing the right things. I've mentioned over the days a few different observations I've had, and truly I haven't gone many places, and so the fact that I can't mention any is not a slight to any. I just haven't been there. I have had the opportunity in the last several days to talk with a lot of our local retailers, because I had a lot of concerns, as you all have, about how some of the retailers were dealing with larger crowds in their stores. And so just in the last few days, I've heard about what they're calling sneeze guards, which is what you may typically know as those things you see over salad bars. But they're now putting them up on the checkout line so that the cashier is not directly face-to-face with the customer. And they're asking people to socially distance in line. They're asking people to socially distance within the store. And some stores are going so far as, and I commend this, to ask people to limit the numbers of their family that are coming into the stores, because it takes one person to shop for the most part. And there are certainly situations where there are single parents with children that don't have another option, but if you do have another option, you don't need to take your family there. Not only can you not control what every member of a family does within a facility, it just opens the doors for a lot more exposure for your family and for others. I've heard so many times today, and some of the things that I heard on the radio and something I saw in a press conference and even the messaging online, is the don't be a vector thing. Because remember, it looks like this disease can be transmitted without having any symptoms. And that's a pretty big difference from the other illnesses that we have seen in years past. So please realize that even if you feel great, you could be making someone else sick. And they may be the person that has the severe symptoms who winds up very ill and could potentially not recover from this illness. The update today with the state numbers is 2239 cases currently in our state. That number is continuing to go up. I heard this morning it was the Nashville mayor was speaking. Well, actually, it wasn't him speaking. It was his press conference. He was actually preparing for his state of metro address. But he said in his city that there had been a big data dump yesterday, meaning lots of results came in, and so their number went way up. And so that's probably, if it's happening in Metro, it's probably happening across the state, probably happening in Sumner. Understand that today we had not gotten that data dump yet, but right now our numbers were at 237 positive in our county. As you probably realize, a lot of those numbers were the result of the nursing home tests that have happened. And so that was the big numbers that came in there for that. With that, Kim, I'm going to let you speak for just a minute. Now, I'm going to take a quick phone call because my phone is blowing up and I want to make sure nothing's going on.
Okay. Well, Kim Baker, Gallatin Chamber, and, I know that we've had some feedback. People said, why do you keep doing these lives? And we keep doing them to keep folks informed. We think it is a good opportunity to be the light, share some positivity that's happening around us, and just keep you informed with the most updated information that we have. And sometimes it's just those numbers, and sometimes it's just good things going on in the community. And so I've gotten a lot of calls today at the chamber office about some specific topics. I'm going to try to do this with lots of hands and things. But one thing I wanted to mention, we've gotten a lot of calls about unemployment lately, and we've gotten calls from employers who are saying, how do I get my employees that are having to take some time away, layoffs, furloughed, to take advantage of this unemployment opportunity. And then we've also gotten calls from employees who say, how do I apply? And so our best answer is to call the American Job Center. We have a local one. We're fortunate that there's one right here in Gallatin. It's on Greenleaf Boulevard. They have extended their hours. They're working 7 a.m. to 7 p.m. And their phone number is 615-451-5800. And that unemployment application is all online, but they have staff that's prepared if you're not able to get online or you're not sure how to navigate that application. They have staff that's prepared to take your call and walk you through that. And so I talked with them early today, and they are revved up and ready to help. And so I think that's a good one. I also wanted to share just a happy that happened today. Last week I had a gentleman in the community reach out to me and say, hey, I'd like to help some businesses. I think I told you about this. He said, I'm retired. I know that small businesses are the backbone of our community, and I'd like to support them, and I want to take a check, and I hope others will do that too. And so his name was Mr. Larry Peak. He's retired from Ball State Community College. He retired in the 90s. And I actually met him from a safe distance today at Mama's Kitchen, and he handed them a check, and then we went on to Philly's, and he gave them a check. And I had no idea. He had told me maybe $100. Well, Mama's Kitchen called me when they left, and it was a $500 check, and he gave Philly's a $500 check. And I share that just because I think that's just a good story of some good that's happening in Gallatin, and I hope it encourages you to support a business during this time as well. So,
Well, I appreciate. Whoops, Jeff turned me off. He thought I was going to be on the phone. I stepped away to take a phone call. It was the director of our Sumner County Health Department. I always take his calls. He and his staff have been fabulous with calls that we get or information that comes in about concerns about businesses. They are the ones who promptly follow up and check on what procedures are in place at what business to make sure that employees and their customers are protected. So, Mr. Hendricks, I appreciate all that you do, and I appreciate you calling, and I'll get you that phone number in just a minute. You were talking about something really good in our community. I want to share, too, that in spite of some of the negativity we see here and there on social media, on the television, even in our day-to-day interactions, there is so much good in this community, and there is so much kindness being extended. Probably one of my favorite stories, and I just heard it for the second time because I'd heard it from EMA earlier this week, is that there's a company here in Gallatin that's a pretty advanced manufacturer, and they stepped up and said, hey, we can make face masks, and they are making face masks right now. And I think that's just a tremendous shift of someone who's done it voluntarily to help a very large need in our community, and I appreciate that. We also know that so many people are sewing face masks, and there are people that appreciate those greatly, and so that's just a really kind gesture. So those things are going on. I do want to answer one question that was asked yesterday about the jails and the processes that they have in place to protect their inmates. I spoke today with the chief deputy over there, and he assured me that on intake, because we realize that new inmates coming into the system are where exposure could happen, that new inmates coming in are being thoroughly screened. If they're actually booked into the jail and not immediately released, they go through a second screening, and then they are put into a cell where they are isolated for 14 days before they are entered into the general population. Additionally, they are screening daily their staff and are very strict about telling staff that if they don't feel well, they're not to be there. So they are taking proper precautions, and I just wanted to reassure you with that information. I was excited to hear that they had good processes in place, and he said they're even working on strengthening some of those and getting more PPE for their folks there. Kim, did you happen to mention the grab-and-go meal schedule for the schools? Okay.
I didn't.
They are changing that pickup, and I wanted to make sure that you were aware of that. Instead of doing a daily pickup, they're going to go to 2 days a week. And so the pickup dates at this point are this Friday, and then next Tuesday, and then the following Friday, and the next Tuesday. And on Fridays, you'll be picking up 4 days worth of meals. On Tuesdays, you'll be picking up 3 days worth of meals. The child does still have to be in the car to receive the meals, but I think they've realized how cumbersome it is to have to come to the school every day to get one meal. So the locations remain the same. There is a change in Hendersonville. That one that was at Hendersonville Church of Christ is now at Gene Brown Elementary. So you can find that information online under Sumner County Schools if you need more information. But that is a really good service that is continuing for our students who are not in school right now.
And Sumner County Schools are doing a phenomenal job pushing out resources. And if you're not following them on Facebook, you really should be. And certainly parents check in there. And at this point, there's no necessarily requirements, but there's a lot of tools and resources. And I think our local teachers are doing a great job as to keeping their students connected. I will add something about the sewing machines. Mm-hmm. The reason we were a little later getting started is because I was actually late getting over here, and it's because someone showed up in my office with enough fabric to make 2,500 masks and two brand new sewing machines that they wanted to get out into the community. So that gentleman and I, his name's Robert Dunn. He doesn't live in Gallatin anymore, but he graduated from Gallatin High School, and he just felt the need to help at home. And so he said he wanted them to go to good hands on folks that are ready to make masks and sew for the community.
What an awesome gesture, and what a neat idea. So that's super. Have there been any questions today, Jeff, that you've seen we need to answer?
Well, there was an interesting question. One asked, Cheryl Alexander asked, how many are recovering do we have of these numbers? We hear about cases, but do we hear about recovering?
Yeah, there actually are numbers out there. I know that it's on the coronavirus.com website, and they actually break them into, I think they do, well, I know the state of Tennessee does, how many people tested positive and how many people tested negative, which gives you an idea of how many tests they're conducting. But I think it's on the national website that I think the CDC does, and they actually have an area where they show how many have recovered. And so they keep track of, how many have passed away from the virus, how many are considered still active cases, and then how many have recovered. So that number's pretty small at this point, because realize this virus has a pretty long run. It's not your average 3-day virus. It runs for like 2 weeks. And that's one of the reasons that our healthcare system can so easily be overwhelmed, is this is not a virus that requires a short hospitalization or a short treatment window. It's 2 weeks or better. And I even saw something where, like, the average for the people that unfortunately do have to be ventilated, the average length of time that they're on the ventilator is something like 17 days. Maybe it was 17 to 19. It was a long time versus a normal average for people needing ventilation, which is like 2 to 3 days. So that's why it's such a burden on the healthcare system, and why the critical need patients are such a concern, and why we're all trying so hard to keep the virus at bay and not be vectors, as I said earlier.
Mary Garkey says she can sew, so we know who Mary is.
Good, thank you, Mary.
And also, someone was curious about how these homemade masks are being used. I bet they're being used for visitors, maybe, as opposed to doctors, or do we know that?
I think some of the masks can be used with filters, actually, by people in the medical profession. And I think, too, that I heard this early on. I don't know if this remains true, but a lot of the reason to use the mask is to keep from sharing the virus versus protecting yourself from getting it. It's to protect others from you sharing it. Should you call for sneeze or whatever. For me, I need it to quit touching my face.
I think the mayor and I both need like a face mask at this point. We get a lot of comments on how we touch our face or different things. I think I have also read, and I don't know this for sure, but I've read that some of the healthcare workers are using them to cover their other mask, and then they can take that off, wash it, and it expands the life of one or the other. I don't know exactly. But I think also just people in the community too, those folks that are shielding their faces when they're going to the grocery store, and I think just different purposes.
And there are a lot of people that have been making masks in the communities. I know this weekend when I was over at the Emergency Services Center, they had quite a few masks there that someone had brought to them. I know that, remember little Lucy Blaylock from
She's
Union?
making masks too.
She's making masks. She's the one that did the Lucy's Love blankets, and there was a sweet story on her and the number of masks that she and all of her siblings and parents have turned out.
Did you mention Heather and Heidi?
And Heather and Heidi were making masks.
A set of twins here. They have a small embroidery business, and they do a lot of that already. And so now they've shifted gears and they're making masks. And I think I saw today they'd already made several hundred. So that's really neat. And they're donating them.
Yeah, and I have seen some people on Facebook mentioning that they are making masks, but they need elastic. So I don't know if anyone out there might have a stash of elastic they'd like to share, but that's a need that I've seen expressed too. Yeah. So, no other questions?
Well, there's a tough question. Are we doing anything to stop non-essential businesses from being open?
Well, the non-essential businesses, per Governor Lee's orders, are mandated to be closed. And so if they are still operating, we can make them close. If the ones deemed essential are still operating, we are checking on them and we're trying to help them operate safely to protect their employees. And in Governor's Order 22, there's lots of guidelines for safe operating of businesses, and we encourage all businesses and employees to check that out, because even if you're an employee of a business, you might be able to offer some suggestions if you feel like something in your business isn't operating as it should, to help keep everyone safe. I would think that most good businesses would appreciate that input and would try and do those things.
And we have those orders posted on our website.
Okay, very good. On the Gallatin website, which is GallatinTN.gov, there is a coronavirus page, and so those orders are actually posted there. Thank you.
Yeah, I don't really have any. Are there any other questions?
I don't see. Let's see. Not anything that you haven't covered already.
Okay. We appreciate you all. Let's hang in there together. Let's be tough. It's hard. People are really feeling the strain. I'll share with you something I read this morning that was really meaningful to me, and it might make you think about stuff. There's an alderman. He's actually from Gallatin. He's an alderman in Hendersonville. His name's Russ Edwards. He's an attorney. And did you see this morning? Mm-hmm. He shared this thought that he had, and he was talking about, you're carrying a cup of coffee and somebody bumps into you, you spill that cup of coffee everywhere. If you're carrying tea's going to spill out. And when life bumps you, what spills out of you? And so if you're filled with happiness and kindness and joy, that's what's going to spill out. If you're full of fear and anger and hostility, when life bumps you, that's going to spill out. So that's Paige's, actually it's Russ's thought for the day, shared by Paige. But I did appreciate it. It was meaningful to me. It made me think about how I'm reacting to the bumps I'm coming up against, and I hope you will as well. And let's be tough for each other. Let's show what kind of community we are, what we're made of, and let's be the people that stop the spread of this virus in our community. This virus is our enemy, not each other, and so please remember that.
Yeah. Hey, we'll see you tomorrow. We'll be back on at 4:00. Have a good day and make the most of it. You say bye? Bye. Bye.
Bye. Have a great